Okay, so now we're going to go ahead and turn it over to Jim. Jim?
Well, thank you, Megan. Thanks, everyone, especially everyone logging in. We appreciate that very much. We've made some changes, and we think it's really important, and we appreciate everyone joining us on webinar here today. We've made a couple of very exciting changes to our mastectomy program, and we hope these changes will make mastectomy accreditation more attainable, and also will open the certification path to more individuals who wish to start a career in this important profession, or people who have been thinking about doing it, and there's been a couple of speed bumps in the way. Hopefully we can eliminate the majority of that to really help everyone who would like to be in this profession go ahead and join in. So let's take an overview of what we're going to be discussing today itself. First of all, we're going to be discussing ABC's decision to reduce the number of standards required for mastectomy-only facilitation accreditation. Now, make that very clear. Mastectomy-only facility accreditation, okay? And so we're going to include why the standards were reduced, which 43 standards you'll have to still comply with, and how this will affect you and your accreditation and your business, and how that'll change that. And second, what I'd like to go over is ABC recent changes in fitter eligibility requirements and how this change can benefit your business and the profession itself. So, the standard reduction for mastectomy-only accreditation. I feel it's important to start by explaining why ABC chose to reduce the number of standards required for the mastectomy-only accreditation, your boutiques and your practices. Feedback from facility owners, our feedback from surveyors and mastectomy professionals, what it did is spurred a conversation about the need for the reduction. So we created a task force to tackle this initiative. Now, I have met many of you. I go on the road. I'm on the road about 45 weeks a year. I've been very blessed to go ahead and speak to you. I come to some of your practices. I see you at some of the meetings, and I get a lot of the feedback from you. That feedback is extremely important. And that information, what I do is I go out on the road, I take that information, collect it, I bring it back to ABC, and I share it with all those in ABC. And because of that, that is one of the reasons that we've gone ahead and started this task force with this. So previously, the facilities applying only for mastectomy accreditation had to comply with 101 out of the 141 patient care standards. Effective March 1st of this year, now, today is February 16th, so March 1st, in a couple of weeks, the number of standards required for mastectomy accreditation will be, as I mentioned before, 43. We've gone down from 101 to 43 for mastectomy facilities. The task force and the ABC board determined the mastectomy-only facilities need only to comply with those standards that are specifically appropriate for their patient care services. And what we hope this change will help give focus to improve patient care and business efficiency, for your mastectomy facilities and your boutiques. Now, that's the why. So let's go ahead and dive into the 43 standards that are required and explain why they were selected and why some of the other ones were omitted. Now, you notice that we go along that a strong focus was put specifically on standards that address patient care and business operations. So let's go through them by categories, okay? We have the categories. I think that's probably the most common sense way of going through them. First are administrative standards, which is AD. You'll know them as AD. These standards are the basis for your entire business and address the legitimacy of your business, your internal policies and procedures, and your compliance with Medicare, CMS, and HIPAA standards. All of the standards, except for AD7, are still required in this category. For administrative standards, the only one that is omitted is AD7. And everything in AD7 that would relate to mastectomy facilities is also covered in AD 1.1. So it's still covered. Now, if you're complying with all the federal, state, and local laws, you're also providing reasonable physical accommodations to your patients. So in reviewing the administrative standards, the only exception we have now is AD7. So let's go ahead and move into human resources standards, or HR. Now, these standards apply to all employees providing patient care at your facility. Mastectomy facilities are often smaller businesses, the boutiques, and with only usually a handful of employees. Some are larger, but majority of them have a handful of employees. So as such, many of the eliminated HR standards were either too detailed for mastectomy business structure, or they had elements covered in other standard categories, or don't even apply to mastectomy-specific patient care. Now, while you no longer need to have specific HR policy and procedures that address employees' duties and responsibilities, you still must document that all employees providing patient care have current certification and licenses when required in that state, and you still have to provide written objective criteria for any credentialed or non-licensed staff that you wish to privilege. So those are still in place. So many elements of the previously required HR standards that apply to mastectomy facilities are either covered in the administrative standards, or they pertain to devices or equipment or specialty personnel, all of which mastectomy-only ABC-accredited facilities do not provide. You don't provide those. So that's why we've trimmed those human resources down. Now, on to one of the most important standard categories we feel is most important. It's patient care and management, or PC. Patient care, seriously, is why all of us have got into this profession. It's the first place, and why it's important to understand and comply with these standards itself. Now, while it may appear that we have removed the standards requiring that you have a written policy and procedure manuals or employee handbooks or however you want to call those, that is not the case. I want to make that very clear. We still need the policy and procedure manual or employee handbook. You must still have a policy procedure manual, but you're no longer required to list the responsibilities and job descriptions for each one of your employees. So patient care management standards that reference products or devices that mastectomy-only facilities do not provide, such as, I'm going to hit these, PC 0.2.1 and PC 2.3 and PC 3.5, they have been eliminated. Other omitted standards pertain to patient treatment plans. Now, it's obvious you are essential in helping your patients reach their post-mastectomy goals and outcomes, and you still need to document what those are. You're not formulating a treatment plan to aid in the mobility or physical function. Therefore, standards such as PC 3.4.2, which apply to the treatment plan, and PC 5 are no longer required for mastectomy-only accreditation. That should help out a lot on that. So, as you already know, ABC's accreditation standards always include any standards mandated by CMS or Medicare. So that is still the case. And what we're going to do, Megan, we're going to provide a list of which ABC mastectomy-only accreditation standards are also Medicare DMEPOS standard requirements in today's presentation handout. So as Megan mentioned earlier, we will have the downloadable handouts. We're going to go ahead and put the list of the CMS required standards and Medicare DMEPOS standards that ABC also will comply with on that. So that'll be a handout for you there. Previously, you were required to have written contingency plan for emergencies and disasters as part of the patient care management standards. A written contingency plan is no longer required, but you still must conduct your annual emergency evacuation drills. Now that's required in standards FS 3.2.1, but it's required here. And what we do is we need to document the drill that was that occurred and who participated. Okay. Now, I know I've spoken to a lot of you and I presented to a lot of you. If you are an ABC accredited boutique and facility and practice, then in 2015, ABC has come out and we've created a lot of accreditation tools and templates. And we do have a template for emergency evacuation drill. If you are not using that yet, and if you're accredited with ABC, please go right to our website, abcop.org. And I'm going to give that website, don't do it now, stop it, don't do it now, wait until we're done. And I'm going to give that website out a little later on also. And you will be able to find that template under accreditation. And you can use it, print it out, fill it out each time you do your emergency evacuation drill, have the information on it. It's a very simple template. And when the surveyor comes, that's what they'll check for. It's very simple, and you're going to be compliant in the standard, just like that. So you're in good shape. Okay, so our next standards category is product safety, PS. Here's the deal with this. Only one standard, PS 9.2, and that's a CMS supplier standard, remains in this category. All of the other standards specifically referenced equipment which are not applicable to mastectomy facilities. So for under product safety standards, it's very simple. Only one stays, and that's 9.2, and that's a CMS supply standard. And that'll be in the handouts also as Megan said, you can download afterwards. So patient safety, PS, major changes in that. So let's move on to patient record standards, PR. Patient records are extremely important and should be kept secure, confidential, and consistent. Now you'll see that you're no longer required to have written policy and procedures that address the creation and maintenance of patient records, but you still have to ensure that your records are secure, easily retrieved, and include all federal, state, and local and payer required documentation. Now, when the surveyor from ABC comes, your on-site surveyor, they will still want to see that those records are secure. Okay, so it must be kept in a secure place. If you have the hard copies, if you have the electronic copies, they'll be able to check that as well. You must also continue to document your patient's needs for an item. Okay, please remember to document the patient's needs for that item. The eliminated patient record standards are either covered sufficiently under another category or more focused towards orthotic, prosthetic, and orthotic patient care. That's pretty much what we have on the patient record standards. So our next category, standards category, is performance management and improvement, PM. Now, given the smaller scale, as I said before, given the smaller scale of most mastectomy businesses, your boutiques, and your practices, conducting extensive reviews and trends analysis for your business strengths and weaknesses can require more time and staff resources than you have available. We know that. That's common sense, okay? You still are required to have performance management program and to conduct patient satisfaction surveys. Now, the patient satisfaction surveys, as I mentioned before, remember I mentioned those tools that ABC created in 2015, and if you're accredited with ABC, they're on our website under Accreditation, and you can look under the tools, and we will give those to you. What we do is we even created a template. We created a patient satisfaction template that you can use if you'd like. Just pop your own logo on it, and it's yours. So we have all the tools to help you with that. But once again, you're required to have a performance management program to conduct patient satisfaction surveys, but not for the extensive reviews and trends analysis for the business strengths and weaknesses. Okay? The information derived from these services and surveys can be a great tool for improving your business operation, right, and your patient care, which is extremely important. And any negative feedback you receive, it can serve as a warning of an area that may need improvement or attention. I do know everyone does patient satisfaction surveys or customer satisfaction surveys. You can receive great information for these. Please don't poo-poo it and put it aside. I would really take advantage of that. Now, it's recommended that you review your survey results and put them to good use, but you'll no longer be required to document evaluations or measurements of patient satisfaction. It's going to be a big time saver for you. Under Facility, Safety, and Management Standards, FS, a safe facility is extremely important, but many of the previous safety standards were geared towards specialized equipment, fabrication, and detailed emergency evacuation plans and performances. Now, these areas of accreditation are not as critical for the mastectomy businesses because you don't necessarily have those specialized equipment or the fabrication needs in your practice itself, in your boutiques. Therefore, only 2 FS Facility Safety and Management Standards are now required. Those are FS 2.1, which requires private treatment areas, and I've been into many of your practices and facilities, and of course you have those, so the surveyor will check to make sure you have the private treatment areas or fitting rooms or however you would like to call that, and FS 3.2.1, which requires that you conduct annual emergency evacuation drills, which we just talked about, and we said ABC has the templates for those. So we have those available for you if you're accredited with ABC for no cost whatsoever. So last but not least are the Claims and Billing Compliance Standards, which we call CB. Here's the deal with this. All of the ABC CB standards are also required by CMS, Medicare, and therefore still required. And once again, I'm going to remind you, on the handouts we have at the end of the webinar, that listing will be in the handouts. So you'll have that at your fingertips. You can just download those. We want you to be successful in your accreditation compliance and still be able to run your small business with the same high standards and with such little stress as possible. That's extremely forced. We popped down from 101 standards down to 43 common sense standards for your businesses. Now, We hope that these are more focused accreditation standards, and we hope that they improve your accreditation process for you. It won't be such an extensive process for you to go through this accreditation survey for you and your staff, and we hope that it'll help you spend more time focusing on your patients that we all know is really the most important thing. They're extremely important. Hopefully that'll happen. Before we go anywhere further, I think, Megan, is this the place you'd like to do a poll?
Yes, we'll go ahead and launch a poll.
Excellent.
Transition us over to the next topic, and
okay, so the poll here, it says, what is the biggest roadblock to becoming an ABC certified mastectomy fitter? We're kind of moving into the fitter area now. So your options are getting enough experiential hours, finding someone to attest for your hours and experience, or attending the required pre-certification course. So feel free to go ahead and select one. Go ahead. I don't think you can select more than one. Just go ahead and select one, and then we'll hit that real fast there. Megan, do we have a lot of people responding?
we do. We have lots of answers. It looks like 81% of us have voted, and the most popular answer is getting enough experiential hours.
Well, that's an excellent point. As I told you before, I mentioned, and if I haven't met you personally, I apologize, and I'm sure I will at some point. I'm all over the country all the time. I'm speaking to mastectomy fitters. I'm speaking to boutiques. I'm speaking to O&P organizations and practices and state meetings and national meetings and such. It is my honor and it's my privilege to do that. I think in my heart there's a fantastic place for mastectomy fitters. I've never met a more group of individuals who have more compassion and more passion for what they do. And bless you for that, and I thank you for that. And I do get the feedback. I do hear the feedback. And so what I'd like to do is I'd like to address a little bit of this, okay? Before we open the floor for Q&A for the questions, I wanted to take a little time to review the ABC recent fitter eligibility criteria changes. We are making some changes in the recent eligibility criteria, okay? ABC was looking to make its certified orthotic mastectomy fitter credentials more accessible and attainable. So what we've done is we've introduced 2 new pathways for each certification. Now, since I'm not talking to the orthotic fitters right now, what we're only going to do is we're only going to cover the mastectomy fitters today. But if you're interested to see the criteria for the orthotic fitters, please, by all means, that information is available on our website, abcop.org, under the orthotic fitter certification pages. So if you're reading ahead of me, you're going to see some good news ahead of this. As you can see from the chart, the changes for Pathway 1 focus primarily on the number of experiential hours or an individual must obtain and who can attest to their knowledge and skills in patient care fitting. We're talking the hours of experience, that 500 hours that we're discussing. Candidates still have to complete a pre-certification course. That's going to happen. You need to complete the pre-certification course, but now it must be an ABC-approved course because INCOPE is no longer approving the fitter courses. They've decided to no longer approve the fitter courses, so ABC picked that up, and ABC is now approving the courses themselves. Now, the experience hours have been reduced from 500, as you can see it's highlighted, to 250. That's a huge change, okay? A lot of people have said they've had difficulty. We found that many individuals looking to become certified as mastectomy fitters had a difficulty obtaining the experience hours as well as finding someone to attest to those hours. Now, not only can a certified mastectomy fitter attest to the hours, so a certified mastectomy fitter can attest to the hours, but so can a licensed mastectomy fitter if you're in a licensure state, or an O&P practitioner if you're doing the work in an O&P practice, okay? Big change, big change. So 500 hours are down to 250 hours, and now the attestation can be done by a certified mastectomy fitter, a licensed mastectomy fitter, an O&P practitioner. Now, additionally, you'll notice that a secondary pathway has been offered also. Take a look at that. So individuals that are already hold a certification or license in a related allied health profession, Okay, so if it's an individual who's already certified breast care nurse, an oncology certified nurse, etc., and something in those areas, they are only required to have 125 hours of experience. Okay, so that's a big change also. I have been fortunate that I've gone and I've been a guest at some of the certified courses and the pre-cert courses, and I've gone and spoke to a lot of you at the courses themselves, and there have been those attending who are nurses, who are certified breast care nurses and oncology nurses, certified nurses, and they're looking to do this, become certified mastectomy fitter also, whether in the hospital settings or in a boutique or one of your facilities, and dropping the hours down to 125 hours, I think is going to really help them, it says. So ABC hopes that these exciting new changes will open the door to those who have an interest in mastectomy-specific patient care. Hopefully, this will help the profession out. Hopefully, this will help you out. But we know you've been previously ineligible, some of you, for ABC certification. You've had difficulty meeting the requirements due to limited experience opportunities that are available and the attester restrictions of some of the restraints. So I want to make something very clear, okay? We mentioned before the accreditation standard changes go into effect March 1st, right? We still have a couple of weeks before that. Today's the 16th of February. These standards for the fitter eligibility criteria, these go into effect April 1st, okay? April 1st. So April Fool's Day, April 1st. We have about a month and a half. So we have a couple of weeks before the accreditation standard change and about a month and a half before the certification standard change. I think what we'd like to do right now is we'd like to, if we've received Q&A, Megan, if you've received any questions, we'd like to go ahead and hit that. And I do have standing by here Kyle Sins. Kyle is with ABC, and Kyle is the Standards and Compliance Specialist, and he focuses on accreditation standards. And Kyle was working with the task force that created the new set of standards. Pardon me, the standards that remain, the 43 standards remain. So Megan, at this point, do we have any questions that maybe we can go ahead and try to address? If we don't have time to answer all the questions, or maybe some of the questions are a little more extensive, what we will do is, we have done this in the past with our webinars, we have answered those questions in print and send them out electronically to all attendees. So we want to make sure that everyone gets an opportunity to have their questions answered. If you come up with questions after this, after the webinar, which it wouldn't surprise me if you do, please don't hesitate to send them to us, and we will get those answered as quickly as possible to you. And when I say as quickly as possible, that means very quickly. Okay? Megan, do we have any questions?
Yes. First question is from Lisa, and she asks, mastectomy only accreditation. Does this apply only to boutiques or facilities that do only mastectomy? As an O&P facility, do we still need to meet the 101 standards?
Fantastic question. So, excellent question. So I don't want to give any confusion here. This is specifically for the mastectomy facilities and boutiques. If your organization offers orthotic and prosthetic care and pedorthic care, then the standards go way back up, okay? Now, ABC has 142 standards, a complete 142 standards, okay? Prior to this, the mastectomy facilities, as I mentioned, only had to comply with 101 out of those standards. Now it's down to 43. But if you do offer the other patient care services for orthotics and prosthetics and pedorthics, then you must go ahead and it bumps back up to the rest of those standards. We have on our website, we have a tool on our website, maybe to help you out with this. If you are working at a facility that offers the other services, that we have a listing, and it's electronic. It's a tool where you we have all of the services that you may provide for orthotics and prosthetics and mastectomy care and pedorthic care. You scroll on that, you click any service you provide, scroll down to the bottom, hit enter, and what that does is it pulls up a list of all of those 142 standards that apply specifically to your practice. But today we are speaking specifically to mastectomy boutiques and mastectomy facilities for those 43 standards. I hope that answers it.
Yeah, and that relevant standards tool that Jim's
Relevant standards guide. Yes.
yeah, that he's talking about is available on the website. And all you need to do is just log in with your facility's information, and then you'll be able to access that and plug in whatever services you provide, and it'll generate a custom list for you. So,
Very,
okay.
very good tool. Very helpful tool. Yeah.
All right, our next question. Let's see. This comes from Janine. Says her husband and herself, they own a P&O facility where she's a CFM and they see mastectomy patients. Is this
Okay.
for, so again, this is only for mastectomy only accreditation.
Exactly. And if you offer the other services, you would, and there are many practices that P&O and O&P practices that offer mastectomy services. God bless you. That's wonderful. There are many that do that, but you must follow the standards for all of the services you provide. And the webinar today, we're specifically talking to those 40, when I say refer to the 43 standards, those are specifically to mastectomy standards.
Okay, we've got a question from Natalie. She is actually, she's currently working with a CFM or a certified mastectomy fitter, and she's
Great.
taking her fitter course next week.
Wonderful.
She asks, once I feel comfortable seeing patients, can I see those patients on my own and have her review and sign off while still completing the 250 hours, or does she have to be present for all of the fittings?
Kyle, I'm going to ask you to come in on this. I will give, Kyle, go ahead and give your answer. I think I have it set, but I would like to introduce once again Kyle Sens, who's our standards compliance specialist, and then we can talk about privileging as well. Kyle, are you there?
Yeah, I'm here. Hey, everybody. All right, so to answer your question, once you sat for your fitter exam and received your certificate, you're now qualified to see patients. You no longer need to be co-signed or supervised.
Okay, I think Kyle, I think the question is referring to taking the course and getting her experience hours during the period while she's getting the 250 experience hours.
Okay, I'm sorry, I misunderstood. Okay, so yeah, so when you're getting your 250 hours, you still need to be supervised and co-signed. That's when you require the written objective criteria. That's basically the explanation of who's going to supervise you, why you're eligible, and then you need to co-sign within the 15 days. So while you're getting your 250 hours, you still need to be properly supervised and privileged.
Exactly, and thank you, Kyle. We refer to that as privileging. You will need a supervisor to it's pretty much three things. We have objective criteria, written objective criteria, and as Kyle just said, that basically tells you, and once again, if you're accredited with ABC, we have a template down, or not template, we have information pages in our tools that we've created for that, and those are right at your fingertips. But we have a written objective criteria that says who is going to be doing this, why are you being privileged in this, who's going to be attesting it, okay, so who's your supervisor. Then we need to have those notes in the patient record by you who are being privileged. We need the patient records to be reviewed by the supervisor and signed and dated within a 15-day period. Now, personally, I think 15 days is very, very luxurious. If I was supervisor, I would do it as quickly as possible. I speak to a lot of mastectomy fitters who say that they review the notes prior to the patient leaving, prior to your customer leaving the practice, your boutique. Remember that the supervisor, all the notes go under your ABC certification number until that person is actually sits for the certification exam and becomes a certified mastectomy fitter.
Okay, so we do have another question. This has to do with the continuing education. They're asking if the continuing education requirements will stay the same, even though the eligibility criteria has changed.
Right, Kyle, has this been addressed?
No, that part I'm not sure about.
Okay,
I can tell.
Go ahead.
I was going to say, I can tell you that the continuing education requirements have not changed.
Okay.
They will continue.
And there's a good reason for that.
Right now, as it stands, the same requirements are still applicable to all fitters, regardless of the eligibility requirements that you get in with.
Yeah, and it's required every 5 years, and I think we feel pretty confident that a 5-year period is enough time to be able to get those the information and to get the CEUs, your continuing education credits during that 5-year period, and it's there for a good reason. The courses are changing, and any improvements in the healthcare, mastectomy healthcare, all the groups, the organizations that are providing the courses, they are changing and they're updating constantly. We have some wonderful organizations in our profession that are offering these courses, and they keep up to date. And so, if you are coming through, if you've been certified, and someone else is coming through 4 years later is being certified, and they take the course, the fitter course, they're going to have more than likely the latest and greatest information at their fingertips. That needs to happen also with our certified fitters. It's extremely important. Any profession that has certification does have that continuing education program. We look at it as extremely important.
Okay, so another question is somebody also taking their course next week. They're wondering if they would fall under the old criteria of 500 hours or if they will be in the same window for the new 250.
Okay, when you apply, here's a excellent question. When you apply for your exam, when you apply to be able to sit for the ABC's mastectomy certification exam, you need to have, what we will have is we'll have an attestation form, and that attestation form, will be submitted to ABC. When you sit for your exam, we need to know the amount of experience hours that you have gained, okay? If you're not going to be sitting for the exam before April 1st, then it'll be 250 hours. If you sit for the exam prior to April 1st, it'll be 500 hours. So if you're taking your course coming up next week, I'm not sure if you'll be starting getting your experience hours after that, but if that is the case, then I think you're pretty well safe off that you'll be taking the exam after April 1st, and you will only need the 250 hours. Anyone prior to that, the April 1st date, will need the 500 hours. So great question.
So, and then the next set of exams after April 1st will be May 9th through 14th, and those dates are available on our website as well.
So you are able to apply for the exam the month prior to that. Feel free to apply for the exam the month prior to that, and you'll just need the 250 hours with your attestation form.
Okay, let's see. We have a question from Bonnie. She says that ABC mailed out an accreditation calendar for 2016, which we did, and it included relevant facility standards. Will we be providing a copy of the revised list and effective date for those standards?
Megan, I'm going to ask you, is that part of the handouts? I know it's on our website. Is that correct?
Right. It's currently on our website. So what was provided in the calendar is still applicable. You're just going to have to take a look at what's on the website and see which of those standards apply to you. So you'll want to focus in on those and look at the tips for those particular ones. And that is available on our website. If you go to abcop.org, you'll click on the Facility Accreditation, Patient Care Accreditation section. And then from there will be a menu item that says Mastectomy Only Accreditation. And that will give you a list of the standards as well as some additional information and also the effective date, which we discussed earlier is March 1. We'll also include that information in the handouts, and all of that will be available in the email as well as on our webinar library on the website.
That's great. Megan, on that email that we send out after the webinar, is it possible to put the link, just put a link to kind of take everyone, all of us, straight to that?
Yes, it's exactly what we'll have is a link for the webinar library.
Perfect. Thank you. Thank you.
Okay. We have a question, and this might be suited best for Kyle. It's very specific. It's from Jerry, and the question is, how will you address mastectomy fittings that take place in a department store?
Yes, Kyle.
Yeah, so they have to meet the same standards. You still have to have all the ABC standards are met, whether it's a department store or solely a boutique. If that department store only offers mastectomy services as what we're going to accredit them for, then it's just going to be the same standard. They have to still have a patient care room. They have to maintain patient records. There is no difference. It doesn't matter what kind of a building it's in. It matters what they're providing, and it matters that they incorporate the ABC standards that are applicable to them.
And each of the department stores that are accredited with ABC as of today are following those accreditation standards.
Correct.
So the only
store,
right.
Department stores are not given any fewer standards than what's always been required for any other ABC facility. A department store that offers a service still has to maintain the patient care standards that we have, which would be the same ones that you would incorporate into a solely patient care location.
Exactly.
Okay,
so the only changes be is reducing those standards.
Yeah, if they solely offer mastectomy services, then they would meet this requirement now. If a department store only offers a mastectomy service, then they would only have to meet the mastectomy only standards.
Very good.
Okay, we have a question from Darius. They're asking if a BOC certified mastectomy fitter is working for a facility that has ABC accreditation, can they attest for the hours of someone wanting to become a fitter?
I'm almost sure they can't. Kyle, was that addressed?
As far as I know, we recognize the BOC credential in our facility, so I've never heard that a BOC practitioner cannot sign off.
Yes. So that will be that is acceptable.
Certified or licensed, either one, regardless, can attest for the hours.
And we say licensed because as of right now, there's a certain amount of states that have, like for those who aren't in those states, have certain amount of states that require licensure. The majority do not, but there are certain states that require licensure.
Okay, I'm just running through the questions here, see what else we've got. Okay, it says under CB4, this is very specific, so probably another Kyle question. Under CB4, is there a suggested amount of files per quarter that should be audited?
Okay, so we kind of leave this up to the determination of the facility. What I can tell you is that we usually recommend at least 10 patient charts be audited because that's the starting number our own surveyors use when they go to a facility. So it's kind of vague, I know, but basically a larger facility should naturally audit more charts, and a smaller facility would kind of naturally audit less charts. But I throw that number 10 out there as a starting point. That's the starting point our own surveyors use.
Kyle, if I can add to that, our surveyors look at 10 patients' charts per certified practitioner, first certified fitter.
Right. Each practitioner should be audited.
Exactly. So if you have 3 certified fitters in your boutique, then starting at 30 patient charts, that's a good place to start. And and if I could throw this in, and I know I don't mean to make this sound like an ad, but we've created all these tools, and we have templates on ABC's website that will help you with that audit. And if you find issues or things that are missing within the patient charts, we have a template to fill that out, and you do this audit every so often, and you'll start eliminating the issues because you're going to have it right in front of you. You're going to have the issues and how to correct that. So once again, on our website, we created a total of about 17 of these tools and templates and helpful hint things that really take advantage of. If you're accredited with us, please take advantage of that.
Okay, we have a question from Deborah. She's asking, would a licensed massage therapist fall into the 125 hours? Same as with the oncology nurses and things like that. And I can actually answer this one. As far as I know, it's determined on a case-by-case basis. So if it can be proven that you have the experience needed for mastectomy patient care, then they will take a look at that. But you will have to just go in and on the application provide that information about your background.
Very good.
Okay. And if you have any additional questions about specifically what can be considered eligible for an additional allied health profession for mastectomy fitters, you'll want to email our certification department, and all of that information is available at our website as well if you need specific answers for that, or you can call us and we can certainly answer your questions.
Yeah, you can email or call any of us and we'll make sure we get the right person to give you the correct answer.
Okay, this is a specific one about surety bonds from Julie. She's asking, is the surety bond still required? And if yes, has the amount changed?
Kyle? Apparently a surety bond scares Kyle. Kyle? Are you there?
I'm sorry.
There we go. Okay, very good.
I hit the wrong button. Yes, the surety bond is still required. That's a Medicare requirement, and the amount has not changed.
Very good. So as and once again, in the handouts, you will have the listing for the Medicare requirements. So the surety bond is a Medicare requirement, and we don't have the authority to change that.
Okay, let's see. We have a question from Alicia, and she's asking, so being an ABC mastectomy fitter in Florida, she's allowed to sign the attestation form for any other employee. Is she allowed to sign the attestation form for any employee in training?
The answer is yes.
Yes. Let's see. Lots of good questions in here. Okay, Lisa's asking, do we still need to document the annual review of our policies and procedures?
And that is, and I'm assuming, Kyle, if you're joining with this, I'm assuming she's talking about the survey will look for documentation that they have reviewed and updated their policy and procedure manual or your employee handbook. Kyle, will that still be looked for by the surveyor?
No, that was originally a PM standard. Well, they'll still be kind of encouraged to do. It's no longer in the mastectomy standards.
Okay, very good. You know, one point I'd like to make is and you're coming up with some fantastic questions. We dropped the standards down to 43 standards, which I think hopefully will be extremely helpful to your business and practice. That doesn't mean that some of the other standards that were omitted weren't good business practices. And so I don't want to get the point across saying these were bad standards or these weren't standards that are good for your business. They still, relatively speaking, they are. And just because the surveyors will not be searching for those and making sure that you're compliant in that area, as you're running your business itself and your organization, it's still, a lot of these standards are still good business practices to follow.
Okay, Patricia asks, she is actually in the queue to be surveyed, and she's wanting to know if the handouts from today will be available immediately. We are going to try to get those out as soon as possible, hopefully within the next day or so, and so that way you'll have that information available before you get surveyed.
And may I say, we have a staff here at ABC. We have an accreditation team, and we have people who basically it's their job to respond to your emails and answer your phone calls if you have any questions. So please, I think it's Patricia, please don't hesitate, especially since you're in the queue for a surveyor to arrive soon, please don't hesitate to ask any questions of us if you need the answers. We're happy to do it.
Okay.
Our website has all of the staff and specifically what their focus is. So once again, don't hesitate.
Okay, we have a question from Anne. She's asking about, do the 250 eligibility criteria hours meet Medicare requirements as well?
And the answer will be yes for that. ABC set the 500 hours for that. We would not be able to reduce those if they didn't meet it.
Right, and I don't think that the individual, and Kyle, you can correct me if I'm wrong, the individual's certification does not pertain to Medicare requirements. Is that correct?
Exactly, for accreditation, yes.
Right.
Yeah, so your certification, specific certification, doesn't have any bearing on the CMS requirements. Okay, next question. Let's see. Lindsay is asking, she says that the fitters at companies with O&P, will fitters at companies with O&P services still need 500 hours?
I'm not sure what
So I
for mastectomy.
so I think that there maybe is a little confusion at the crossover because we talk about two different topics today. Um, your accreditation is not going to have any correlation with your fitter
Experience
eligibility.
hours.
Right,
Exactly.
exactly. So that has changed, and so has the standards. Reduction in the standards. But if you have fitters at an O&P facility, they will fall into the new fitter eligibility criteria after the April 1st effective date. And so if they're applying after that time, then they would fall into the 250-hour requirement.
Right, and I understand the confusion. There's a little bit of confusion. We discussed today ABC accreditation, which had the 101 standards, and now we've reduced it down to 43 standards for mastectomy fitter facilities and boutiques and practices. And then we discussed eligibility criteria for becoming a certified mastectomy fitter with ABC, and that's a separate category, separate area, and that has gone. The pathway has gone down from 500 to 250 hours, and then who can do your attestation forms also, and who can attest to you. So those are kind of two separate things, and I understand the confusion. I apologize for that.
Okay, we're just looking through. There's a couple of repeat questions, so I'm trying to find something new.
No problem.
Okay, so we've got a question about from Susan asking, will the new mastectomy standards be available in a published booklet as we've received in the past?
Since Megan is in our marketing department, Megan, I'm going to ask you to answer that.
Yes, and the answer is yes. We're actually coming up. We have a accreditation guidebook, which is what you were referring to, specifically for mastectomy. It is going to cover all of the 43 standards, as well as the tips that are specific to your business and your practice as a mastectomy facility. And so it will be a very specific book for our mastectomy only facilities, and that will be available soon, and that will get mailed out to all existing facilities, and anyone who applies will also receive that as well.
Very good. Since we're just making the changes now, it's happened rather quickly, and so now we're kind of catching up with getting all the printed material and everything out to be the high professional standards that we require here. So that'll be coming shortly. Don't have an exact date, and that will be available in the hard copy, and I'll be bringing that around as I see you across the country. I'll be bringing that with me, and Megan will also have it available on our website, which you can download the electronic version.
Right. Okay,
I think we have time for another question.
Let's see what we've got here. Question about, do the HS transcripts still need to be provided? That might be a Kyle question.
I'm sorry, the what transcripts?
HS? Are you familiar with that?
I think I'm making the assumption because of transcripts. I'm making the assumption, and hopefully I'm not wrong, from the prescription from the physician itself. Maybe that's what we're talking about.
The medical history, yeah. Any requirement from Medicare that's like a patient charting requirement, we don't have the authority to waive those. That will still be required.
Exactly. So that if that's what the question is referring to, then definitely that'll still be there in the patient's charts. That'll still be there. Needs to be there. We have had yes, Megan.
I was going to say, I think this is a good one to go over. Diane is saying that she's already got all of her 101 standards in place, and when she's ready for her reaccreditation, is it okay for her to leave all the extra standards in there from her manuals? It's an overachiever.
Who asked this question?
This is
Who asked
Diane.
it? Diane, bless you. Yes, of course. Of course. That's a great question. You will not be marked off for doing extra credit. That is good for you. And it really sounds like you're doing your best to run your organization, your business, with the best business practices available. So good for you. Yes. The 43 standards are the minimum that our surveyors will be required to look at, and they will not be required to look for more. But if you have it, then that's fantastic. Megan, you're going to be following up with an email. Am I correct? Actually, why don't we wrap it up here, Megan? But why don't you remind everyone about the quiz and everything that they'll be receiving, and if there's anything else that we'd like to talk about, including, please fill out the survey and let us know what other discussions you would like to have. Okay? Hopefully this webinar has been very beneficial to you. I'm really hoping it has. Give me the feedback when I meet you out on the road, but feel free to fill out the survey and let us know how this went, but also let us know what you would like to hear about, what you'd like to learn about, what can we help you with, okay? Megan, anything else you'd like to share?
Yes, we just popped up the contact information. We've got information for Jim as well as our accreditation department. Feel free to let us know if you have any questions, and we'll get to those. Anything that we didn't answer today, we'll certainly look over the list of questions and try to get those answered and sent out to everybody, and or have them in the handouts so that you can go through the link and find them there as well. We are recording this today, so that recording, like I said before, is going to be available on our webinar library, and that's at abcop.org. And the link for the quiz, the survey, as well as the handouts, all of that is going to be available in the follow-up email. And our webinar, in case you didn't know, we also have a YouTube channel. So if you ever want to go check out any of the videos or webinars that we have available, you can also see them on our YouTube channel. So that's all I've got.
Megan, on behalf of Megan and Kyle and myself and all of ABC, and I want to thank you, but I'm a son of a survivor. I'm a dear friend of survivors, and I want to thank you personally for the work that you do. I'm dead serious about this. I thank you personally for the work that you do. We need more people doing the work that you do, and from my heart, I want to thank you. That's all we have today, and hope you have a wonderful day, and wherever you are. And if you see me out on the road, I'm Jim. If you see me out on the road from ABC, please come up and say hi to me, okay? Thank you so much. You have a wonderful day.
Thank you.